It is normal to occasionally experience heartburn, but if you are experiencing it frequently, it may be caused by a disorder. Heartburn is commonly caused by acid reflux disease, but if symptoms are severe, they may be caused by GORD. Symptoms of GORD also include bad breath, bloating and belching, and pain when swallowing. So, what is GORD? GORD stands for Gastroesophageal reflux disease. It is a condition in which the reflux of the stomach contents enters the esophagus. Here is the stomach. It contains strong acidic juices so it can break down food. It can handle acidic juices because it constantly secretes a protective mucus lining. Here is the esophagus. It connects your mouth to your stomach, but it does not produce mucus, so it can be damaged by stomach acid. The lower esophageal sphincter, or LES, prevents stomach acid from entering the esophagus. The LES stays closed, except for when you swallow. It opens to allow food to pass through, then closes again. Sometimes the LES relaxes when it's not supposed to. So, what causes this? Most commonly, transient lower esophageal relaxations, or TLESRs. TLESRs are spontaneous openings of the LES triggered by the stomach being enlarged. This can be caused by ingestion of a meal or gas inside the stomach. Factors that can weaken the LES muscles include eating fatty foods and people who smoke or are overweight. So, what exactly happens when the esophagus is exposed to stomach acid? Here's a close-up of the cells inside the esophagus. They are flat and smooth and not acid resistant like stomach cells. When they are exposed to stomach acid, they get very irritated. This is called esophagitis. If left untreated, the cells will be replaced with tall mucus-producing cells, the same type of cells found in the stomach. This is called Barrett's esophagus. In rare cases, Barrett's esophagus can turn into esophageal adenocarcinoma. So, how is GORD treated? Firstly, lifestyle changes, including eating smaller meals, avoiding fatty foods, and stopping smoking. If little improvement is seen, then the next option is to reduce the acidity of the stomach acid using medication. Antacids are an option. There are also H2 blockers and proton pump inhibitors. To understand these, we will take a closer look at the stomach cells. This cell secretes acid into the stomach via its proton pumps. It also has 3 different types of receptors that, when activated, will cause the proton pump to pump acid even faster. Let's look closer at the H2 receptor. When H2 binds to this receptor, it will activate it, so medication called H2 blockers have been developed to bind to and block this receptor. PPIs bind to the proton pump irreversibly, resulting in a significant reduction in the amount of acid being secreted. If medication doesn't resolve the symptoms, then surgery is considered. The most common surgical procedure is a laparoscopic fundoplication. This surgery uses the stomach to reinforce the LES. This is done by pulling the top of the stomach upwards and wrapping it around the LES. Another less common surgical approach are endoscopic therapies. Thank you for watching.